Injuries to the musculoskeletal system can happen anywhere, anytime, any place. They're considered to be a common injury, and although they are almost always unpleasant and painful, they can also rarely be life-threatening when taken care of properly. It's also important to mention that failure to properly recognize and care for musculoskeletal injuries can have serious consequences and result in extreme conditions such as a permanent disability or even death. We will go over the guidelines for recognizing and caring for musculoskeletal injuries, but first, the structure and function of the body so that the concept of care for musculoskeletal injuries is easier to understand. The musculoskeletal system is made out of bones and muscles which form a skeleton, and it contains different parts such as tissues, tendons, and ligaments. These structures work together to give the body shape and form its stability. Movement is provided when various muscles and body segments work together. To begin, muscles are considered soft tissues that function by contracting and relaxing. Most of the muscles on our body are called skeletal muscles, which are muscles that attach to bone. All body movements result from the skeletal muscles contracting and relaxing. Many are considered voluntary movements because you move them voluntarily. For the most part, skeletal muscles are anchored to a bone at each end by strong cord-like fibrous tissues called tendons. Through a series of neural pathways, muscles are stimulated to contract, with the end result of tendons pulling the ends of the muscles closer, therefore pulling the bone, causing motion at a joint. In addition, injuries to the brain, spinal cord, or nerves can affect muscle control, and that loss of muscle movement is called paralysis. Bones are dense, hard tissues. Their shape and form are made to stand the stresses that are placed on them or their function. Our skeleton is made out of 206 bones of many different sizes and shapes. They protect our organs and other soft tissue. Joints are formed by the ends of two or more bones coming together at one place. They allow for motion in our bodies. Ligaments are fibrous connective tissues that hold joints together so that they allow movement. In other words, they hold bones together at a joint. Now that we have a basic understanding of human anatomy, we will go into detail about injuries to the musculoskeletal system. Injuries occur when force is applied to bones, joints, and muscles. There are three basic causes of musculoskeletal injury. The first one is twisted force. It happens when one part of the body remains still while the rest of the body is twisted or turned away from it. The second cause of injury is indirect force. This happens when energy is transmitted through the body and causes injury to the body part away from the point of impact, such as falling on an outstretched hand or hurting your shoulder. The third cause of musculoskeletal injury is direct force, just caused by injury at the point of impact that is either blunt or penetrating. Next, we're going to talk about the types of musculoskeletal injuries. There are four basic types. They are fractures, dislocations, sprains, and strains.
Fractures are known to be a break or disruption in bone tissue. Fractures can be classified as either open or closed fractures. Open fractures happen when the skin over the fracture site is broken, while closed fractures leave the skin unbroken and are more common than open fractures. Types of fractured bones can be chipped or cracked, as well as broken all the way through. Dislocations, on the other hand, are displacements or the separation of a bone from its normal position at a joint. They're usually more obvious than fractures and are usually caused by violent force tearing ligaments that hold the bones in place. Sprains are the partial or complete tearing or stretching of ligaments and other tissues out of joints. They usually result from bones that form a joint going beyond their normal range of motion. Strains are caused by the excessive stretching and tearing of muscle fibers or tendons. Since tendons are stronger than muscle tears, will usually occur in the muscle itself or where the muscle attaches to the tendon, and often result from lifting something too heavy or working a muscle for too long. Now we're going to go over checking for musculoskeletal injuries. The primary goal is to prevent further injury and to get medical attention for the injured person. It's going to be a bit hard to distinguish what type of injury there is, as only a medical professional can do that. However, you don't need to know what kind of injury a person has to give appropriate care. During the head or toe check for non-life-threatening conditions, you will identify and care for the injuries in the musculoskeletal system. As you conduct your check, look for clues and find out information that could help you understand how to best help in the situation. Signs and symptoms that a musculoskeletal injury has occurred include the following: hearing a snapping sound, a person feeling pain in the injured area, significant bruising and swelling, significant deformity, meaning their area might be twisted or strangely bent compared with the other side, the person being unable to use the affected part normally, seeing visible bone or fragments sticking out of the wound, a feeling of bone grating, which happens when two pieces of bones rub together, having the injured area feel cold, numb, and tingly, and lastly, just because the injury suggesting that it might be severe. When caring for the musculoskeletal injuries, it's important to always have a reassuring approach towards the person with the muscle bone and joint injury. They might be frightened and in severe pain. The important part is to keep the person in a stable position, avoid moving the injured part until advanced medical personnel arrive. You should call 911 or the designated emergency number for musculoskeletal injuries if the signs and symptoms for musculoskeletal injuries are present. General care for injuries towards the musculoskeletal system include the following mnemonic of RICE, which stands for rest, immobilize, cold, and elevate. During rest, you should avoid any movement or activities that can cause pain. Do not try to straighten any fractures or move the injured area. Find the most comfortable position to rest until help arrives for the person. An important thing to know is that if you suspect injuries to the head, neck, or spine, remind the person to remain still and avoid moving them until EMS arrives. You will not want to hold the person's head or try to restrict movement, as this could lead to further injury. If you must leave, place the person in recovery position if you are alone. During immobilize, you must stabilize the injured part if you suspect a serious musculoskeletal injury. Some of the purposes to immobilize are to lessen the pain, prevent further damage to soft tissue, reduce the risk for severe bleeding, reduce the possibility of bad circulation to injured parts, and to prevent closed fractures from becoming open fractures. Something to note is that the injured area must be stabilized in the position it was found. In addition, you must splint the injured part only if the person must be moved or transported on professional emergency personnel to a medical facility for treatment. When splinting, these 4 basic principles apply. Splint only if you have to move the person. It can do so without causing pain or discomfort. Splint an injury in the position in which you found it and move nothing, straighten nothing, and bend nothing. Splint the injured area and the joints that are above and below the injury site. And lastly, check for proper circulation, which includes feeling warm and color before and after splinting, and loosen the splint to access circulation. Continuing on with cold. The cold helps reduce swelling and helps pain and discomfort. Making an ice pack contains a plastic bag with ice and water, or using frozen vegetables such as peas. Commercial cold packs also works, and make sure to always place a layer of cloth or elastic bandage between the source of cold and the skin to prevent damage to the skin. Leave the cold pack on the injured part for no longer than 20 minutes. If you cannot tolerate 20 minutes, you can do it for 10 minutes and switch. Never apply a cold pack to an open fracture, as this could possibly make the injury worse. Instead, place it around the site and add no heat, as there's no evidence that applying heat helps. Lastly, during elevating the injured area above heart level helps in slowing blood flow and reduce swelling. However, you should only elevate the injured part if it doesn't cause more pain. Furthermore, don't attempt to elevate a severely injured area of a limb unless it's already been immobilized. When thinking of considerations for transporting a person, there are a few things to keep in mind. Certain situations where there is need for medical attention for a musculoskeletal injury, yet it does not require you to call 911. For example, in a situation where someone is suspected of breaking their finger. In this case, when transporting the person to a medical facility, bring someone along or having someone else drive is important so you can keep an eye on the person and take care of them if needed. However, someone with an injury to the pelvis, hip, or thigh can be considered to have a life-threatening injury, in which case the person should not be moved unnecessarily. The best thing to do is minimize movement until EMS personnel take over to help prevent injury from turning into a worse one. In conclusion, although it might be a little hard to distinguish what type of musculoskeletal injury someone is suffering from, there are still ways you can minimize pain and discomfort while avoiding that the injury becomes even more severe. Control any bleeding and take steps to minimize shock, reassure and comfort the person, and monitor the person's vital signs. If you need to transport the person to a medical facility by yourself, always be sure to immobilize the injured part before moving the person.